Good morning and welcome everyone to today's webinar. Firstly, to introduce myself, I am Elijah Gibson, a QUT intern for Community Resourcing, and I will be the moderator for today's webinar, exploring the implications for community care providers. This webinar is part of a series of sessions being facilitated by Community Resourcing for the Community Care Smart Assistive Technology Collaborative. If you've joined previous webinars, you'll know that they have been designed from feedback and requests we have received through the collaborative. Our webinars are about bringing together local, national, and international perspectives in research and development, as well as focusing on deployment of smart assistive technologies in the community care sector. Community Resourcing has extensive international linkages and have been fortunate enough with many international projects and research entities. Just a reminder, if you haven't formally registered at the collaborative site, this site is accessible to all and is free to register. Please note that neither Community Resourcing or the Department of Community Child Safety and Disability Services are promoting or endorsing any particular product, research entity, or organization. Our webinars serve to inform viewers of examples of various smart assistive technologies in development and/or deployment. As attendees at today's sessions, and in the interest of recording, we have muted your microphones. We encourage you to ask questions, and these questions can be added to the questions panel on the dashboard to the right of your screen. There will be an opportunity at the end of the sessions to have these questions answered. At previous sessions, we have been inundated with questions, so post your questions early to ensure that we can cover this in today's session. In this webinar, we have Livingstone and Gavin Tomlins. They will introduce the Aged Care Industry IT Council, as well as go through a rundown of the technology roadmap addressing some of the ideas around implementation of this roadmap and its research project. This webinar will seek to identify and provide an understanding of any key considerations with respect to technology, which emerges from the project, exploring some of the rationale, including strengths and weaknesses of the project. Anne Livingstone is the chair of National Home Care Committee of Australian Aged Care Industry IT Council. She combines over 35 years' experience with her focus on innovation and digital inclusion. Anne is passionate about helping the sector embrace the opportunities offered by technology with the aim of using the power of digital technology to vastly improve the situation of people with disabilities, the aged, and carers. Gavin Tomlins is the chair for the National Home Care Australian IT Council CIO's Forum and CIO of Sundown. Gavin has had more than 20 years' experience within the information, communications, and technology industries, being an active participant of the Australian IT Council and not-for-profit CIO Forum. Gavin has a strong passion for social responsibility and technology innovation and the opportunities it brings to assist the healthcare section. Welcome, Anne and Gavin. Take it away.
Thank you very much, Elijah. It's a great honour to be able to present today on the work that the Aged Care Industry IT Council has progressed on developing up a technology roadmap for aged care. And today we'll be concentrating on the implications for community care providers and the community care sector. Just a little bit of information about the Council. The Council was formed in 2007 under the banner of Aged and Community Services Australia and the then Aged Care Association of Australia, now Leading Aged Services Australia. The specific intent of the Council was to raise technology issues, particularly with policy and decision makers, but generally to improve technology uptake and innovation in the sector. The Council had a particular emphasis on harnessing technology to create sustainable aged care services into the future. In 2014, the Council underwent a governance review and also underwent significant structural change. you'll see on the next slide that the council today, the council has a board of 5, 2 independent directors and an independent chair. At the moment, we have an acting chair and we're awaiting the full-time appointment of the independent chair. 2 significant board members are the CEOs of each of the peak aged care organisations, so Pat Sparrow for Aged and Community Services Australia and Sean Rooney for Leading Age Services Australia. They're supported by 2 nominated independent directors, and those directors are currently Janine Buckley, representing the ACSA Independent Director, and Glenn Bunning, representing the Leading Age Services Australia Independent Director. Significantly, in 2014, we underwent a structural change, and this graphic shows you the structural arrangements for the governance of the council currently. We are supported by a secretariat, and there are 3 committees of the council. As Elijah mentioned in our introduction, I chair the National Home Care Group that looks specifically at issues of home-based and community-based care. My colleague and co-presenter for today, Gavin Tomlins, is the chair of the CIOs Forum, a very active group looking at issues specifically in terms of the technology, infrastructure and deployment. And Rod Young, who chairs the very successful ACIITC conference committee and also has been a colleague working specifically on this research project. Some of you may know that we've undertaken significant amount of investigation and research into the issues of technology and the sector's needs. One of those activities was that in 2015 we produced a vision document called Digital Care Services, where the emphasis was trying to encourage the sector to think big, start small, but scale up rapidly in respect to deployment of technology. I thought I'd undertake just to detail a couple of the key activities of the council, and particularly the committees that work for the council. So Gavin is with me today, and he chairs the CIOs Forum, a highly representative forum of CEOs across the nation, both from very large organisations with very robust technology support and infrastructure to very small organisations that perhaps don't have a dedicated technology service or infrastructure. Some of the activities that they've been working on, they've been developing industry KPIs for performance both of operation and of vendors and the ecosystem around technology. They've been doing some work around developing up a library of templates, including contracts, policies and procedural activities, and this serves as a really great support for the industry, but also for providers who may not have the level of infrastructure that some organisations have. One of their main strengths has been the holding of many collaboration forums and also holding the ICT infrastructure survey. Uniquely and importantly, they've been working together on an employee exchange program, and there's been lots of examples of great practice now being shared across the CIOs Forum. The National Home Care Group has concentrated on research scoping and presenting the Board of Directors with some opportunities to initiate research such as the one we're demonstrating today with the development of the technology roadmap. Together, the groups convene the Gateway User Testing Groups, or now co-design groups for the Commonwealth, and we've got a highly representative group of individuals who come together and have currently undertaken a vast degree of co-design, co-creation workshops with the department. We've been particularly active in the lobbying and advocacy and providing the individual peaks with information about the sector. And we've been working very hard on collaborations, and so currently we're meeting in a combined forum regularly with the CIO's forum. We're regularly meeting with NDIS linkages, and we've been leading the carriage of work around facilitating and formalising international connections and collaborations. I hope that many of you on today's webinar have already attended and experienced the Information Technology in Aged Care conference. Now 10 years old, this year's conference is highlighting Navigating the Future, and it's going to be held on the Gold Coast of the 21st and 22nd of November. I'd encourage you to attend. It's become the premier event for aged care and technology in Australia. This year we were overwhelmed with the interest in abstracts and speaker spots, and this year's format is going to provide some very new and emerging issues and opportunities to collaborate and discuss the future. But what we're here for today is to discuss with the group participating today the Technology Roadmap Research Project. This project came about from discussions that we had, I think early in 2016, and in conjunction with the release of the sector roadmap. At the time we felt somewhat concerned and challenged that the sector roadmap didn't focus on the issues of innovation and technology. So we set about providing a brief for a research project that could develop and overlay the sector roadmap with the issues related to technology. So in terms of the objectives of our roadmap research project, we set out from the beginning to identify key global research and particularly quantitative evidence that was currently available in respect to deploying technologies and advancing the aged care sector. We set out to do this in a very consultative way with the industry, and that was certainly led by the Aged Care Industry IT Council Board and its committees, and we canvassed a range of views and considered the input of experts into the project outcomes. Our key requirement was to really detail the technological advancement and options required to meet all the obligations that we saw the future of the aged care sector, and to align those as much as we could in the aged care sector roadmap 9 domain areas. And Gavin's going to talk about that alignment later in this presentation. We also wanted to mirror what the aged care sector had done in identifying short-term, medium and long-term considerations really required to position our sector for the most appropriate uptake of innovation and deployment of technology. You'll note though, however, in our work that most of the objectives we saw were in the short and medium term. And we set about to detail recommendations, particularly identification and detailing of what other funding and regulation changes were required to actually see a mainstream large-scale adoption of technology across the sector. And finally, we were really keen that if indeed there were other considerations in respect to technology that weren't identified in the sector roadmap domains, that we could highlight and present those. So in a nutshell, the intent of the Technology Roadmap Research Project was to complement the aged care sector roadmap, to reflect its underlying principles, but to apply a filter of technology to the way that care is provided and business systems support and evolve around aged care organisations. We recognised that there was a need to outline a vision of an innovative, technology-enhanced sector, and particularly to use this vision to help policymakers evaluate the benefits that technology will bring, as well as provide guidance and information not only to the board and the members of the Aged Care Industry Council, but also to organisations who might be considering strategically their journey around technology and innovation. So what did we do? The key methods and key outputs that we achieved, we did a comprehensive literature research, and you can gain access to that. We both looked at the published but also the grey literature relating to ageing and technology. And in that we've provided 2 reports, a complete report and a summary report. We did several consultation processes, but in particular we did a key workshop with the aged care industry IT committees and various attendees and representatives from aged care across the nation. And we did this in line with the ACIITC conference in 2016, in where we developed up a discussion paper and we held a day-long forum. On top of that, we held a number of individual and group interviews, and from the start we identified a number of experts or collaborators that we needed to involve in the program, and this was done with experts from both this country and overseas. And we produced a full roadmap and a roadmap at a glance chart. I'm going to hand over to my colleague Gavin Tomlins, who's going to detail the drivers for the technology roadmap and the specific domain areas. Thanks, Gavin.
Thank you very much, Anne. As Anne's alluded, there was a number of research conducted by our partner program, Flinders, having a look at the overlapping areas currently present within the ageing industry. Obviously, Australia has a tsunami of ageing people coming online. That mapped with the consumer choice coming through, the aged care reforms, and also what we can learn from our sister industry in terms of NDIS and the disruptive technologies taking place and how they all come together in a holistic view to basically form what we need to do within the industry to drive the roadmap. Underpinning the values of the technology roadmap was the research and literature that aligned with the initial aged care roadmap and those aged care sector statement of principles. Basically, those principles focused around that of consumer choice, the support for informal carers, the principle 3 of contestable, innovative and responsive type information, and making it both affordable for all and sustainable. So the technology roadmap and its vision statement went to align those particular destinations. So if reading through the destination of the roadmaps, you can see destination 1 outlined the business operational systems and basically underpinning all the aged care services. Destinations 2 to 5 but basically focused on the service providers and how they deliver that service provision. For each destination, the research team basically had a look to see what's in place, come up with a proposal, what needs to be changed, so for each of the service providers to take that away and how we can speak to industry and government and articulate that in the form of issues, what needs to be done, and also a plan of action. As Anne alluded to before, we have a short-term, medium-term and long-term action point for each deliverable. As I mentioned, the aged care reform was founded on the twin principles of choice and control, which applies to enhance technology and enhance the quality of life going through. And all technology, when we're applying to those principles, need to be flexible to support consumer needs in line with the reforms of direction of choice and control. Over the last 2-3 years, we've seen an unprecedented era of change within the industry. So there are a number of new players. So the traditional monolithic approach by service providers needs to be more flexible moving forward. Obviously, there is ageing in place and a drive to keep people within the home. So there's a greater need for technology for use in the private homes that needs to be integrated and personalised. So there's a greater push for that. And the development of technologies to provide care and provide support-based evidence in terms of co-design and collaboration. The government at this present point in time through the ACIITC is sort of embracing that co-design principle as well moving forward. And we're quite proud that's evident in some of our UAT teams moving forward. The roadmap also outlines the effectiveness of technologies. They must be evaluated over time. So gone are the days of us basically putting in a piece of technology that lasts for 10 years. So it needs to be agile and effective, and preferably through co-evaluation with the end users. So having the consumer in mind in centre of all these particular principles. And lastly, but not least, is technology must be integrated into aged care policy and processes. We've conducted a survey that basically looks at how that is taken in place, but we'll discuss that a little bit later on. If we have a look at Destination 1 of the roadmap, it basically talks about a technology-enabled operational business and communication type systems. It outlines basically the need for interoperability and open standards and common platforms. Traditionally and historically within service providers in the industry, there's been single silos type events that needs to be taken away. Also, there is the roadmap outlines the underdeveloped technology readiness in the sector, basically how we can go about addressing that. They've fragmented capacity building and a failure to embed technology in aged care historically through funding and lack of initiative from the board level in industry providers and being able to have technology throughout the process in the workforce. The Destination 1 also speaks about the need for a national data exchange and the readiness for electronic data usage. So a lot of that's around B2G, our DEX and data exchange programs, and how we do the interoperability from the healthcare practice from the GP through to the service provider. And also just basically having an open ecosystem to encourage secure data exchange. Destination 2 speaks about the enhanced care and support for older people. So as we said previously at this present point in time, I guess there's been what's been seen to be service sector silos. So we have to work out how we can do cross-pollination and also the failure to integrate technologies as care features of aged care. A lot of buildings and development historically hasn't put technology as a forefront and how we can optimise processes. So it outlines those particular principles. It also speaks about the informed choice and improved system navigation and what we can do to go through the process. And again, it brings up the point about the insufficient co-design in designing care for the elders. So there is a big emphasis on co-design, collaboration with those principles. Destination 3 talks about the technology-enhanced information and access to care. So at this present point in time, it's underdeveloped and equitable to consumer readiness. So what are the short-term and long-term goals and how we can address those particular issues? And also there is factors put in there within the roadmap that basically address the factors in determining what is stopping organisations from adopting their technology and the principles involved. Sorry. Within the roadmap, we speak about Destination 4, the enhanced assessment of eligibility and changing needs, and what that means to the consumer and to the service provider. At this present point in time, within a lot of organisations, there is underutilisation of technology-enabled assessment and care planning. So the destination outlines what's required to do there, what plans need to be done in the short-term process, and how we go forth from planning that. It speaks about the training process and policy required to enable adoption, providing organisations with a guideline on principles and practice on what they need to do within their particular space to bring along this particular technology enhancement. Sorry, people. Destination 5 speaks about the technology literate and enabled workforce. So within Australia at this present point in time, there's limited workforce and informal care readiness to use technology. Obviously within our industry, it's historically been viewed as an ageing workforce. So what do we need to do to look around that digital maturity, digital literacy and race level of our skills and workers? There is limited teleconferencing or video conferencing infrastructure within Australia, and there is a perceived need to increase this use of technology to better enable service outcomes and delivery of healthcare. There's multiple opportunities within Destination 5 as outlined to improve the workflow and productivity of both the workforce plus the interoperability of government to business workforce and information. I guess some of the critical considerations when we were developing the roadmap was it has to be a proactive approach to the application of technology within the aged care sector. Historically, the aged care sector has been reactive, waiting for the industry to come to us, but as what's been evident in the last 4 or 5 years is the major disruptions in technology, and the roadmap goes out of its way to say that all organisations and industry and government need to be proactively looking at this space right now and how do we go about that. It also outlines that there is a need to have an increased technology readiness, including the digital literacy skills. How do we train our workforce to make them be able to use technology better, to maximise technologies and service delivery and supporting digital infrastructure, everything from the point of care or bedside or within a person's home to the Internet of Things and how we can get about using this technology. It speaks about the integrated and embedded technology for assessment, care planning and delivery. So everything from passive monitoring to that IoT from within the home or integrated living spaces. There was a critical consideration about the agreement on and leadership about the ethical, security and privacy implications of technologies. The Australian privacy law is coming into place, and that has wide-reaching ramifications within our industry and across the nation. Also, what are the processes, structures and networks, technology experts and the aging co-age experts, and how they affect the collaborative co-design and co-evaluation of systems. Historically, things have been built by the government and the industry and vendors in silos, so how can we interact with that? I guess further, just a quick brief as to who was part of the project team to bring this scope of works together. My colleague here, Livingstone, obviously the chair of the National Home Care Group, Research and Development Director of Community Resourcing. Myself, I'm the chair of the CIO Forum and CIO of Sundale. And Rod Young, our elder statesman, he's the chair of the ACIITC Committee and director of the Benevolent Society. We worked closely and collaboratively with the Flinders team, who brought together a team of resources of international renown, led by the most esteemed project lead, Professor Karen Reynolds. Professor Reynolds has a number of distinguished projects to her name, but she headed up the team from the Flinders Research Unit. There was that in conjunction with Dr. Kate Barnett, who is the visiting research fellow for Aging and Aged Care. The restorative Professor Sue Gordon, Strategic Professor, Chair of Restorative Care at Flinders. Strategic Advisor, Digital Health Professor Anthony Mader. Some people may know Anthony's work from CSIRO historically. He's now the Professor of Digital Health Systems. The Strategic Advisor, Rehabilitation and Assistive Technology Director, Mr. David Hobbs, who's doing some fantastic work down in Flinders if you ever get the chance, but he's also the lead in rehabilitation engineer and was aptly managed by Ms. Kamala Sergi. I guess the point was we searched high and far, and we actually went out to market to canvass for teams. Flinders were by far the most well-rounded and affordable solution, which brought to us a well-rounded solution. Post roadmap launch, we have conducted a survey from those people who have actually downloaded the survey to sort of see who is actually looking at the roadmap. As can be seen, there's an initial uptake by the Australian care providers, but what has been of interest is the wide-ranging reach of who is viewing the current roadmap in that sector. We are currently looking at other businesses, so the roadmap is there to be used as a collaborative. With the current CDC model being deployed, a lot of the traditional service providers, we see a number of new entry players to the market. So these people take using the roadmap as an opportunity to see what they need to do to better integrate with the roadmap and aged care service providers. From the type of care provider, we can see that it is rather varied and diverse. Residential aged care is obviously a bit of an uptake with what's going on, but there are organisations with multiple levels and multiple disciplines of aged care services. I guess from a planning perspective, from an organisations are looking more holistically across their wide range of services and how they can utilise the underpinning roadmap. What was of interest at this present point in time is from the survey, nearly close to 50% do not actually have an IT strategy or roadmap on how to deliver their services. In an era of unprecedented change, we found that information rather interesting. I guess the roadmap's there to use as a guiding document on how to better bring that to fruition within your organisation. We did pose a question within those who are downloading the roadmap. What is to do? As you can see, some are there just validating their current strategy to see if it's in line with what the greater industry and government's doing. Basically, though, a lot of people are looking for direction on how they could bring technology and those underlying principles, as we've spoken about in terms of digital literacy, and what are those, what elements do they need to have in a roadmap in the short, long term for their own particular organisation. There is a slide missing. I'd recommend also for people to Google the technology roadmap if you have not already got yourself a copy. It's at www.aciitc.com.au livingstone.org.au/roadmap, where you are able to download a copy today and provide feedback and also start your journey on what you need to do.
Thank you. Thank you, Anne and Gavin, for your presentation today. Again, if you have any questions, please post them on the right-hand panel. Just a question from Philip Harvey. He has asked, how does the research project hope to provide or to improve the workforce productivity issue?
Thanks, Elijah, and thanks, Philip, for that question. I guess we were very concerned that the roadmap both needed to consider the technology and innovation, but importantly, consider the workforce implications and the service model implications. In terms of future workforce, one of the projects that have stemmed out of the roadmap is that we are commencing discussions with the National Institute of Labour Studies, who have the contract to do the 3-yearly, I think it is, Gavin, 3-yearly aged care workforce census, and we're currently developing up a range of questions for the census. Previously, the census didn't really ask a range of questions around a technology-enabled workforce or a digitally included workforce. We know from our research that we're facing a workforce that is extensively digitally excluded, and we've been following some of the analysis that's come out of the release of the first ever Australian Digital Inclusion Index, and it's significant to highlight that the clients that we serve are in the cohorts of the most digitally excluded. The workforce that we extensively have is also one of the digitally excluded population characteristics. But also, I guess it's important to talk about the services that are provided in rural and remote Australia and the levels of disadvantage that we know that those providers have in terms of infrastructure and connectivity. And we hope that we can influence some improvements in that. We're working also in collaborating with a number of projects that have been recently funded by the Dementia and Aged Care Innovation Funds, and we hope to outline any of the issues that are emerging for those projects that relate to workforce issues. So thanks, Phil, for your question.
Just another one here from Michael Wilson. Are there any B2G initiatives post at all?
If I can, I guess the roadmap alludes to a number of the need for interoperability and B2B type situations with the government. I can say that the ACIITC Council has currently been speaking to government on a number of these B2G initiatives, which will occur over the next 12 months. So there are actions in place. Via the various national home care forums and CIO forums, we will be asking for people to join the teams to act as part of those committees for interaction with the government moving forward.
Awesome, thank you very much. And I think just one more question again from Michael. In Destination 3, I think he was just a little bit curious about how the roadmap addresses technology adoption.
In terms of, maybe that's quite an open-ended statement. I guess within there is, in terms of adoption, there is a need within organisations to basically be more prepared and agile with what's happening. It's being informed, leaking to services like this in terms of information and how they go about in the marketplace and how consumers can use technology in an uptake. So part of that's a cultural type situation. So generally you'd say it starts at the top, but people need to be aware of what's happening. I guess there's a need within service providers to recognise, or businesses and organisations, that they need to be embedding technology throughout the entire process. So whether it be in the home from an IoT type perspective, and how they can sort of go about to basically improve those outcomes. There's currently what's viewed is, I guess, from a maturity perspective, to sort of see where industries are or organisations are ready to be able to adopt that technology moving forward. So you need to have that in your own strategic roadmap moving forward. How does it work out? What technologies are coming in place from 1 to 3 year type plan? The roadmap does actually outline a short-term, long-term type thing. So from a national perspective, there is talk about the need to have a national digital literacy strategy. So as Anne was alluding to, that workforce initiative, how do we make certain that the employees are ready to be able to use technology? Also, basically being able to raise, even having these type of conversations.
So, and just another question here, asked from Brad. How are you lobbying the government for things like data exports from MAC, Mac to end provider software to enable a much more seamless integration of customer information into provider software?
Great question, Brad. That's both a challenge and a goal that the Aged Care Industry Council does have. We provide lobbying in, I guess, a variety of forms. The council meets with heads of department, including the First Assistant Secretary, on a regular basis, and key department heads, where we provide agenda items around technology, and high on the agenda of that is the interface with My Aged Care. But more broadly also, Brad, the need for governments to consider high on the agenda the business to government interface, and that really is a core strategic intent of the Council's work going forward this year. We're very passionate about the need for improvements, but we're equally passionate about the fact that we need to work in partnerships with the government to achieve that. We're doing a range of work around co-design, as I mentioned earlier in the presentation, and I think those co-design workshops have moved forward considerably over the last couple of years, from perhaps a more reactive process towards faults on My Aged Care and other systems to now proactive, really true user-accepted testing and co-design process, where we're trying to influence the release of what comes out of the department to be more appropriate for the sector, and also to provide some foresight and about potentially issues that we might see on the horizon that might be problematic. So those groups are continuing. The recent one, the co-design we recently did was on release number 8, and we're going into co-design mode on releases number 9 from the government, but there's a lot more work to be done. There's 23 names of individuals on that group, and we select from those 23 who nominated originally. And there was a selection panel on the names that we were able to put forward to the government. We selected people with diverse views and trying to cover all the interest groups and special needs groups and geographical distribution and construction of the different types of service delivery. Along with, there's a range of people that are interfacing with the technology in a very grassroots day-to-day basis, pulling down referrals to those that are managing the systems and process development behind those systems. So a highly represented group, they come together with the department about every 2 months, and we're keeping at the forefront that work. The Council's also in the midst of a strategic planning process, and one of the key objectives, I know that the Acting Chair, Glenn Bunning, is keen to progress is around better advocacy and lobbying in respect to governments. And finally, I'll hand over for my colleague Gavin for other comments, but also we're working closely with vendors, and what we didn't mention is the Council was instrumental in setting up the ACIIVA, the Aged Care Industry Vendors Association, and really why the Council initially assisted in forming that vendor community was that importantly we need to work with technology developers and providers to ensure that products we have in the market align specifically. ACIIVA has now become an independent group and is now aligned with another organisation, and we hope that they go from strength to strength because we believe that it is a partnership between the government, industry and vendors and developers to ensure that we have appropriate systems in place.
Oh, actually, Anne's just covered off. I was going to make reference to the Medical Industry Software Association as well. I guess it's a good question by Brad because it also shows how you can utilise the roadmap and why it's being used. So within Destination 1, we speak about the need to adapt aged care open standards and protocols to facilitate that interoperability and sharing information. So quite a good question, Brad. So as Anne sort of surmised, there are a lot of high-level discussions in place at this present point in time. Referring back to the roadmap that is in Destination 1 in terms of that interoperability. So I guess I'd advise you to reach out to your various committee members to join. As I was saying, there are people, we are actually canvassing people to help with that B2G type situation.
And I guess just in closing, Elijah, we'd like to mention that we are doing a lot of work in respect to the impact of the roadmap. We felt that that was important to evaluate whether we had made an impact. The Council has invested its own funds. We didn't seek government funding for this research project, and it was important to us to see that the sector gets a return on investment. So including the few slides that Gavin provided at the end of the presentation, there is considerable work going on behind the scenes around evaluating that impact. Alongside that, we're also, as a council, investigating the opportunities that this research has provided for other activities. So we're currently developing up a work plan to go alongside the research work, and I hope that that provides an opportunity to target some of the areas that I think Brad's alluding to that need enhanced lobbying and enhanced attention. So we're keen to report on that work as that work progresses.
Thank you, Anne and Gavin, and again thank you for your questions, audience members. Again, if you haven't already, please go ahead online and register at the Community Care Smart Assistive Technology Collaborative, where you'll be able to access today's presentation and for the opportunity to ask any further questions. In the future, we have a few events coming up. One we'd like to highlight is the 28th of August, where the Digital Skills for All Queenslanders Roadshow will be held at Mount Isa. And there is another event happening on the 20th of October for the Community Care Business Transformation and Innovative Series. Our upcoming webinars, we have a few coming up in August, one tomorrow the 2nd of August, one again in a few weeks on the 15th and on the 22nd, as well as a last one on the 12th of September. I'd like to take the time to acknowledge the Communities Care Smart Assistive Technology Collaborative Project team and expert reference group. And I'd like to thank our presenters again today, Anne Livingstone and Gavin Tomlins. And feel free to get in contact again, audience members, to ask any further questions. And thank you for today's session and your attendance.